Welcome back to a weekly review from Sculpt to New You. Today we will talk about surgical drains. What are surgical drains and when are they used during surgery? Many patients that see us for our less invasive tummy tucks and breast procedures ask us if they will have a drain. Drains are used to help lessen and possibly prevent a seroma from forming after your procedure. A seroma is a fluid accumulation that occurs under the skin. This fluid formation can cause various less serious complications after surgery. Despite seromas being a less serious and more manageable complication, they are not fun to deal with. Seromas can eventually lead to the skin incision opening, requiring additional management after your procedure if they are left undiscovered. Seromas, once discovered, can often be managed by draining either on a one-time basis or by inserting a drain after the procedure to allow the fluid to escape and to allow the cavity holding the fluid to eventually close. Not all seromas are discovered, and not all seromas cause problems. Those that are discovered can easily be managed, but it sometimes can require management by you, the patient, or by a friend or family member at home and during the day. Many surgeons use drains for all of their breast reductions and breast lifts. Almost all surgeons use drains with their tummy tucks. Sometimes they use multiple drains. Here at North Texas Cosmetic Surgery, we rarely use drains during any breast procedure, and we use drains only 30 to 50% of the time during our less invasive tummy tucks. The need for a drain is assessed at the time of your surgery. Because we use liposuction with our tummy tucks, the liposuction incisions below the tummy tuck incision allow fluid to drain. Sometimes, though, the small liposuction incisions can close before all the fluid trapped below the skin after your procedure drains out. If this occurs, we are able to place a small seroma catheter into the seroma cavity to allow this fluid to drain until the seroma cavity closes. Even when drains are used, they may not always prevent small seroma cavities, but they can dramatically lessen the chance of a seroma from occurring. So just to show you, this is an example of a drain. It's very soft. I don't know if you can see, but it's got multiple holes in it. Just because if one little tiny hole got blocked, then we don't want the whole drain to block and not allow the fluid to drain out of it. This is the bulb that ends up hooking up to the drain. We squeeze it and then it creates a suction to pull the fluid from out of the seroma cavity. Are there risks to drains? Sure, as with any device or procedure, risk can occur. Sometimes drains can get blocked despite having all those holes, and they can quit allowing the fluid to be released from the seroma. Since a drain is running from a non-sterile environment to a sterile area, sometimes, although very rarely, infections can occur. That is why we at North Texas Cosmetic Surgery will place you on an antibiotic for as long as your drain remains. Your drain is removed when it begins draining less than a certain amount of fluid. We have you keep a log, and then that allows us to know when that amount of fluid necessary for the drain to be removed is less than a certain amount. Removing the drain usually causes minimal discomfort. I hope this week's video explains why and when drains are used and when they are needed. Thank you again for listening to this week's video, and we look forward to talking to you again next week with our weekly review by Sculpt to New You.